I'm a cancer patient. I was diagnosed in January of 2024. I have acute myeloid leukemia. And unfortunately, my phenotype has something like a 90% 3-year death rate. Right. And this is a very, very hard disease to live through. With that survival rate and the level of severity of the illness, it requires very, very extensive treatment, right? And so, what this typically involves are month-long hospital stays for chemotherapy. Right, my last hospital stay was actually 60 days long. And many of my stays were exactly 30 days or longer. But point is, this leaves me with very little time to work. I have recovered as of now, and I'm actually working 2 jobs. This week I have a 54-hour week, but prior to the last couple months, I have not been able to. And, you know, a lot of people think that, like, oh, since you're making no money, you can just hop on Medicaid, right? But I'm on disability because of, the nature of my illness. It's a disabling illness, right? And my disability actually puts me over the income limit for Medicaid. I make $980 a month with disability, and the Medicaid cutoff is actually $900. And I think that's absolutely ridiculous. And if you go further than that, I live in a state where the income minimum for Obamacare was higher than my disability, right? So that means that when I'm on disability and I'm not able to work, I don't make enough money for Medicaid to treat my cancer, which is extremely expensive. And I make too much money to even pay for my own healthcare, right? If I did not get the tax credit from Obamacare, I would literally have to pay like $500 a month for my insurance on a $900 a month income, right? It's not happening. It's impossible. It's impossible to afford that, right? And so the point of all this is that I know there are people who maybe don't work as hard as they should, who are on Medicaid and food stamps, right? And maybe they just need a little kick in their ass to get them on their feet and start working again, right? But with these cuts, it's important to keep in mind that there are going to be more people like me who were trying to go through cancer treatment and dealing with all of the sudden having to deal with thousands of more dollars a year of health insurance, of stressing, because when they cut off my Medicaid, they didn't tell me months in advance. They told me after 2 weeks that I would lose coverage. I had 2 weeks to find coverage, and that is simply not easy. When I had no income, besides disability, I couldn't get the Obamacare tax credit because my rent was basically the price of my disability. I had no extra money for healthcare, which is crazy because if you go a certain amount of time without healthcare in this country, you actually can't get re-enrolled for the year, which is absolutely ridiculous. It's crazy. If I wasn't able to get back to work so soon, I would have been absolutely shit out of luck. And I've gotten very, very lucky with my care. I've lived like 18 months past the initial diagnosis, and 90% of people don't get that far. And I was very, very fortunate to have the first couple treatments really put me into remission. But if these treatments didn't put me into remission, if I was still in the hospital, still dealing with this cancer, my medical bills would have been millions of dollars. And that's not an exaggeration. My last bill from the hospital was $474,000, right? And granted, that's before insurance, but if I didn't have insurance, that would have all been on me. And I would have needed more and more treatments, which probably would have gotten more and more expensive. It's very absurd. We should absolutely not be cutting Medicaid. Medicaid saved my life for the brief period I had it. Before you actually hop on disability, you hop on this thing called SSI, which is lower than disability. And through that, you're able to get Medicaid for the brief time that you're not on disability. That's how I got it. I work in healthcare, and there are so many patients who you have to deal with their terrible insurance. You have to deal with the fact that sometimes they don't have insurance, and a lot of the times what you run into is that certain labs won't take their tests, right? So if you try to send their biopsy test to a pathologist, the pathologist might say, "Hey, she doesn't have insurance. I cannot give this test. I will not do that." And it's horrible because these are life-saving tests that people who don't have insurance are just shit out of luck, and you can't wait until next year for a lot of these things. If I waited until next year when I was diagnosed, I literally would have died. Like, zero question about it. Without the treatment, I would have died. And you can't wait for these things. You absolutely cannot wait. There is no waiting time at all. And yet, these testers won't test without insurance. So if you cut people off of insurance, there are going to be easily thousands of people who die, who can't get their testing done, who are just screwed now. And granted, it's a lot of the fault is with the pathologists, but you have to work in the system you're in. And, at the end of the day, it is the fault of our representatives who decided to cut insurance from, up to 15 million Americans. And the poorest Americans, man, like, come on. It's absurd. It's absolutely absurd. It's ridiculous. And it's frankly disgusting. And even further than that, I don't know if anyone's been paying attention to this, but there's a ton of representatives who sold their stock in Medicaid companies, Centene in the case of Brent Shahan, who sold it on May 15th, by the way, and then voted for a bill that cuts Medicaid. Like, this is the most out-and-out corruption we've ever seen. Even the Gilded era does not come close to this, right? And even further going deeper into the bill, you see tax cuts for billionaires, and it's like, man, who is hurting for money more than billionaires? Like, come on. Why are we cutting taxes for the billionaires while at the same time cutting Medicaid? And somehow after cutting Medicaid and SNAP, they managed to add $3 trillion to the debt. The Republicans are absolutely not a serious party. These people don't care for anything that they say. They're just lying when they say they want to reduce the national deficit. And I really think that everyone should be disappointed by this bill, even the Republicans, because how on earth did they manage to add $3 trillion to our debt while cutting Medicaid and SNAP, cutting aid for the poorest of the poor, and also giving more tax cuts to the billionaires? It's truly the opposite of Robin Hood. Trump is just stealing from the poor and giving to the rich at this point.